Dementia isn't a specific disease. Instead, dementia describes a group of symptoms affecting memory, thinking and social abilities severely enough to interfere with daily functioning. Please like, share, comment and subscribe. Thank you for your love and support. Dementia indicates problems with at least two brain functions, such as memory loss and impaired judgment or language, and the inability to perform some daily activities such as paying bills or becoming lost while driving. Though memory loss generally occurs in dementia, memory loss alone doesn't mean you have dementia. There is a certain extent of memory loss that is a normal part of aging. Many causes of dementia symptoms exist. Alzheimer's disease is the most common cause of a progressive dementia. Some causes of dementia may be reversible. Dementia symptoms vary depending on the cause, but common signs and symptoms include cognitive changes, memory loss, difficulty communicating or finding words, difficulty with complex tasks, difficulty with planning and organizing, difficulty with coordination and motor functions, problems with disorientation, such as getting lost, psychological changes, personality changes, inability to reason, inappropriate behavior, paranoia, agitation, hallucinations. Dementia involves damage of nerve cells in the brain, which may occur in several areas of the brain. Dementia may affect people differently, depending on the area of the brain affected. Dementias can be classified in a variety of ways and are often grouped by what they have in common, such as what part of the brain is affected, or whether they worsen over time. Progressive dementias. Some dementias, such as those caused by a reaction to medications or an infection, are reversible with treatment. Progressive dementias. Types of dementias that are not reversible and worsen over time include Alzheimer's disease. In people aged 65 and older, Alzheimer's disease is the most common cause of dementia. People generally may develop symptoms after age 60, but some people may have early onset forms of the disease, often as the result of a defective gene. To diagnose your condition, your doctor will review your medical history and symptoms and conduct a physical examination. Doctors may order a number of tests to diagnose dementia and rule out other conditions. Cognitive and neuropsychological tests. In these tests, doctors will evaluate your thinking, cognitive function. A number of tests measure thinking skills such as memory, orientation, reasoning and judgment, language skills, and attention. Doctors use these tests to determine whether you have dementia, how severe it is and what part of your brain is affected. Neurological evaluation. In a neurological evaluation, doctors will evaluate your movement, senses, balance, reflexes and other areas. Doctors may use the neurological evaluation to diagnose other conditions. Brain scans. Doctors may order brain scans, such as a CT or MRI, to check for evidence of stroke or bleeding and to rule out the possibility of a tumor. Laboratory tests. Simple blood tests can rule out physical problems that can affect brain function, such as vitamin B12 deficiency or an underactive thyroid gland. Psychiatric evaluation. You may meet with a mental health specialist, psychologist or psychiatrist, who may evaluate whether depression or another psychological condition may be causing your symptoms. Treatments and drugs. Most types of dementia can't be cured. However, doctors will help you manage your symptoms. Treatment of dementia symptoms may help slow or minimize the development of symptoms. Cholinesterase inhibitors. These medications, including donepezil, Aricept, rivastigmine, Exelon, and galantamine, razidine, work by boosting levels of a chemical messenger involved in memory and judgment. Side effects can include nausea, vomiting and diarrhea. Although primarily used to treat Alzheimer's disease, these medications may also treat vascular dementia, Parkinson's disease dementia and Lewy body dementia. Memantine. Memantine, Namenda, works by regulating the activity of glutamate. Glutamate is another chemical messenger involved in brain functions, such as learning and memory. A common side effect of memantine is dizziness. Some research has shown that combining memantine with a cholinesterase inhibitor may have beneficial results. Other medications. Your doctor may prescribe other medications to treat other symptoms or conditions, such as a sleep disorder. Occupational therapy. Your doctor may suggest occupational therapy to help you adjust to living with dementia. Therapists may teach you coping behaviors and ways to adapt movements and daily living activities as your condition changes. Therapy's several dementia symptoms and behavior problems may be treated initially using non-drug approaches, such as modifying the environment. Reducing clutter and distracting noise can make it easier for someone with dementia to focus and function. It also may reduce confusion and frustration. Modifying your responses. A caregiver's response to a behavior can make the behavior, such as agitation, worse. It's best to avoid correcting and quizzing a person with dementia. Reassuring the person and validating his or her concerns can diffuse most situations. Modifying tasks. Break tasks into easier steps and focus on success, not failure. Structure and routine during the day also help reduce confusion in people with dementia.